Bismillahirrahmanirrahim. Assalamu alaikum dear viewers. I am Professor Dr. Muhammad Usman, and in today's short video we will discuss various pressures in the lungs and the mechanics of breathing or the mechanism of breathing. So there are three pressures which are important regarding our lungs, that is pleural pressure, alveolar pressure and transpulmonary pressure. Now in this graph you can see all of these pressures. On the x axis there is inspiration and expiration, and on the y axis we have the pressure. So the first pressure is this pleural pressure. Okay. So at the beginning of inspiration, this pressure is about, as you can see here, it is about -5 centimeter of water. So at the beginning of inspiration this pressure is about -5 centimeter of water, and this minus sign shows that it is a suction pressure. So this is very important because of this suction effect, it keeps the lungs open. It applies a suction effect and it keeps the lungs open. We must remember that this pleural pressure, it is the pressure of the fluid present in the pleural space. So pleural pressure is the pressure of the fluid which is present in the pleural space, and we know that pleural space is the space between the parietal and visceral pleura, and both of these they cover the lungs. As you can see here, both of these parietal and the visceral pleura, they cover the lungs, and in between these two layers, that is parietal and visceral pleura, there is a very minute space or potential space or cavity which is called pleural cavity. So this pleural cavity is filled with the fluid, and this fluid is pleural fluid, and this exerts a pressure which is called pleural pressure. So at the beginning of inspiration this is -5 centimeter of water, and during the inspiration, because the chest cavity or thoracic cage it expands and the lungs expand, so it becomes more negative, and at the height of the inspiration, as you can see here, the pleural pressure becomes about -7.5 centimeter. Then during expiration the events are reversed. Okay, it comes back to about -5 centimeter of water. The other pressure is alveolar pressure, and alveolar pressure is the pressure of the air inside the alveoli. Okay. Alveolar pressure is the pressure of the air inside the alveoli, or you can say it is the pressure of air inside the lungs. When our glottis is open and no air is flowing into or out of the lungs, then the pressures in all parts of the respiratory tree all the way to the alveoli are equal to the atmospheric pressure, that is about 0 centimeter of water pressure. So you can see here that at the beginning of inspiration the alveolar pressure is 0 centimeter of water. Okay. At the beginning of inspiration the alveolar pressure is 0 centimeter of water, then during inspiration it becomes drops to about -1 centimeter of water, and this pressure, this slight negative pressure pulls about 0.5 liter of air into the lungs. As you can see here, this pressure, slight negative pressure, pulls about 0.5 liter of air inside the lungs. Then during expiration the reverse occurs, and this pressure may become 0 or sometime even become +1 centimeter of water. Okay, and it forces the air out of the lungs, as we will see subsequently. So the third pressure is transpulmonary pressure, and it is the difference of alveolar and pleural pressure. Okay, the difference of alveolar and pleural pressure, it is called transpulmonary pressure. So these were the three pressures in the lungs, and now based upon these pressures we will try to build a concept of mechanics of the breathing, or how the inspiration and the act of expiration takes place. So first of all, in this figure we will explain the mechanism of inspiration. Now you must remember that inspiration is an active process. It is an active process in which energy is used. The two muscles of the inspiration are diaphragm and external intercostal. Okay, diaphragm which runs here, okay, dome shaped diaphragm, and external intercostal, as you can see here, these run in between the ribs, external intercostals. So, the major muscle of the inspiration is diaphragm. The major muscle of the inspiration is diaphragm. So, when the diaphragm contracts, what happens that this dome shaped diaphragm, because of contraction, it will become flattened like this. So, this is the situation before contraction, and when it will contract, it will become flattened like this. So, what will happen? Yes, of course, as a result of this, the vertical diameter of the chest cavity will increase. The vertical diameter of the chest cavity will increase. Now, the other muscle, external intercostal, which runs in between the ribs, it also contracts. Okay, external intercostal, they also contract, and due to that, the rib cage, it elevates. Rib cage elevates upwards. So, what happens that the anteroposterior and lateral diameters, I am repeating, anteroposterior and lateral diameters of the chest cavity, they also increase. So, now as a result of contraction of these two muscles, that is diaphragm and external intercostals, what has happened? The vertical diameter of the chest cavity has increased, anteroposterior diameter of the chest cavity has increased, and lateral diameter of the chest cavity has increased. So, in a nutshell, we can say that the chest cavity, the volume of the chest cavity has increased. We can say that the volume of chest cavity or thoracic cavity has increased. So, this is another view. First of all, the diaphragm contracts, okay, diaphragm contracts, and due to this, the vertical diameter of the chest cavity increases. Then external intercostal contract, and due to that, the anteroposterior and anteroposterior and lateral diameters of the chest cavity increase. So, we can say the rib cage has elevated and the volume of chest cavity has increased. So, what happens when the volume of chest cavity has increased? As you can see here, when the volume of chest cavity is increased, the pleural pressure becomes more negative. The pleural pressure becomes more negative. Why? Because the parietal pleura, it has moved upward with the chest cage, while the visceral pleura, which was immediately covering the lungs, it has lagged behind. It is present immediately over the lungs. So, the gap or the volume of the pleural cavity is increased. When the volume of the pleural cavity is increased, of course, the pressure decreases. So, the pleural pressure becomes more negative, it decreases. So, it causes a more suction effect, and due to that, the visceral pleura, it moves towards the parietal pleura, and due to which the attached lungs, they also moved upward, okay, towards the you can say parietal pleura or towards the chest cavity. So, in a nutshell, the lungs expand. So, I am repeating again the sequence of events. First of all, the diaphragm and external intercostal muscles contract. Due to that, the volume of the chest cavity, it increases. Due to that, the pleural pressure becomes more negative. When the pleural pressure becomes more negative, it causes more suction effect and the lungs expand. When the lungs expand, of course, the volume inside the lungs, okay, it becomes more. So, the alveolar pressure or intrapulmonary pressure, they are one and the same thing. So, alveolar pressure, which is the pressure inside the lungs, it also becomes more negative. When the pressure inside the lungs become more negative, then the air from atmosphere from the outside, it flows into the lungs. So, this is the process of inspiration. Okay. Now, we come to the expiration, but before that I would like to explain that sometimes we use also these accessory muscles of the inspiration when we have to inspire forcefully, okay, during exercise, for example. So, the accessory muscles of the inspiration, they can be remembered by 3S, that is sternocleidomastoid, serratus anterior and scalene. Okay. These are the 3 accessory muscles of the inspiration which are used in forceful inspiration. Now, coming to the act of expiration, this is very simple. The inspiration was active while the expiration is a passive process. It simply occurs because of the relaxation of the muscles of inspiration. The muscles of inspiration, that is diaphragm and external intercostal, they relax. They had contracted during inspiration, while during expiration they simply relax. So, when they relax, what happens? When the diaphragm relaxes, the vertical diameter of the chest cavity, it decreases. When the external intercostals, they relax, the anteroposterior and lateral diameters of the chest cavity, they also decrease. So, in a nutshell, the volume of the thoracic cavity, it decreases. Okay? The volume of the thoracic cavity, it decreases. When the volume of the chest cavity or thoracic cavity decreases, then what will be the effect on the pleural pressure? Yes, of course, the pleural pressure becomes now less negative. It had become more negative during inspiration, it had become minus 7.5, but it will now become again minus 5 centimeter of water. So, it will become less negative. So, what happens now? The lungs, they recoil, they just come back to their normal position. Okay? The lungs recoil, due to which the pressure inside the lungs, that is alveolar pressure, it rises above the atmospheric pressure. It becomes about plus 1 centimeter of water, as we have seen in the previous slides. So, the alveolar pressure becomes about plus 1 centimeter of water, and due to which the air it faces a gradient and it moves from the lungs to the outside. So, this was about the process of expiration. Sometimes the process of expiration, it becomes active. Normally, as I said, it is a passive process, it occurs because of the relaxation of the muscles of inspiration. But sometimes the expiration becomes also active process, for example, during exercise, during forceful expiration, or sometimes in patients of asthma, it becomes active process. So, when the expiration becomes active process, then the muscles of expiration are also used, and they are abdominal muscles. Okay? Abdominal muscles, they contract, and internal intercostal muscles, they also run in between the ribs, just like the external intercostals, but their direction is opposite. When the internal intercostal muscle contract, what will happen? That the volume of chest cavity, especially its anteroposterior diameter and lateral diameter, they will decrease. So, when these two muscles contract, the volume of the chest cavity decreases and expiration takes place. I hope that in this short video you would have understood about the pressures inside the lungs and the mechanism of the inspiration and expiration. Thank you for watching this video. Stay blessed. Happy learning to all of you. Allah Hafiz.